Hi everyone, we were looking at all the confusions in the seat matrix, right? We've already completed the first, you hope you have already looked at the first confusion on the duplication of seats between DNB and MDMS in the same specialty in same institute. This is another set of confusions. If you are not confused at all, please don't go through this. Fill your choices based on the seat matrix, that is sufficient. If you want to know answers to a few queries, go through it. Please do not complain saying this is not required information. Right now itself decide you don't want this video, because you can as well go through the entire counseling process without this. But we have received hundreds of queries, almost 240 queries on these issues in total. And everybody, there are a lot of people who are concerned in Telegram groups, etc. That is why we are running those sessions for those who are concerned, who don't have answers yet. So if you want to go through it, please go through it. We'll look at the MDMS PG diploma seat matrix confusions. These are confusions that exist only in terms of MCC. We are looking at the MCC seat matrix and looking at what are the confusions that exist in the MDMS or PG diploma seats. Basically, medical colleges or PG teaching institute seats, not for DNB. This entire session is. First confusion is that a few institute seats are not appearing in the seat matrix sector. For example, AFMS institutes are all not appearing. All the AFMS institutes are not appearing. This is available in NMC. NMC has published a seat matrix dated October 17th. They did it in two ways. One, a total seat matrix, and another, a increased seat matrix. New seats approved kind of. This was October 17th. All government institutes only were part of this list. The total seats had the 2024 endpoint. Where whatever was there in 2024, increased seats were new seats in 2025. So these two PDFs are available. The source is that it has AFMS institutes, obviously it is there. They should come under All India counseling, but after priority 1 and priority 2 are allotted only, in round 2 AFMS institutes will be included. That will also be allotted as per priority. So they are not included in round 1 and round 2. This we already had mentioned in the info guide too. So this is expected. You will get it in round 2 in case priority 1, priority 2 allotment is over by then. Next, Belagavi Institute of Medical Sciences. It is available in NMC. 50% seats should be in MCC. We are looking at only at the MCC All India Counseling seat matrix issues, not state issues. This is missing. We don't know why. Similarly, GB Pant, Betaya, Bilwara, Mahbub Nagar, and Homi Baba Cancer Hospital and Research Center Visakhapatnam, they've added it as a new institute now in the participating institute info. So I hope this will be sorted out. And then you have Institute of Human Behavior and Analysis Sciences, JNIMS Impal, Kasturba Hospital New Delhi. All of these institutes that we have mentioned over here, all of them are available in the seat matrix except for Kasturba Hospital. So basically, wherever the seats are available in the seat matrix, then till this, which are all government institutes, wherever seats are available in the seat matrix, that means these institutes have been missed out. They are supposed to be added. We expect them to be added. We don't see any other reason. We have checked all the legal things too. Most of them seem to be missed out, where the institute has missed out, and maybe NMC adds it in the next round. We are not sure, especially with JNIMS, how they could miss out, but we are trying to see if there is any legal issue. But overall, we see that all of them are available in NMC seat matrix. They have not removed them, so they should be available in the next round, or if we are able to emphasize enough, they might even be added in the this round if they have corrected it. Kasturba Hospital alone, MSOBG seats were available last year. DGO seats were also available. Right now they have removed the MSOBG seats from NMC seat matrix, and the DGO seats are available. We are not sure if there is an issue here, and these seats have been cancelled. We haven't got inside information. We are trying to get that. Next we have Hamdard. Hamdard has an internal issue with respect to the transparency and how the finances were handled. So NMC has removed them from the seat matrix. So basically Hamdard seats will not be available unless there is a legal direction that Hamdard can take. So this is not going to be there in the seat matrix. We were surprised when initially they had this in the seat matrix, because MBBS there were no seats. Now Hamdard is a known issue. It will not be there. Siddhartha Begur available in NMC. They are also missed out. These two deemed universities, again we feel that in these two deemed universities, Hamdard might not be available, Siddhartha might be available, T. Begur will be available later in the seat matrix. So these are the missing seats. Purely, if you had gone through our first session on how the entire surrendering works, somebody in the institute missed out. This happens every year. Somebody in the institute missed out surrendering the seats by logging into MCC's intra-MCC portal is what has happened. That is one. Second issue is, this is again with respect to AEQ or government quota or deemed seats in MCC only. New seats. there has been a seat increase. They are not appearing in All India Round 1 seat matrix. Around 2330 MD/MS seats in government, and yesterday they had put up 958 increase in deemed. You can see that as 966, but there are duplicate records within the same specialty. So we are going with 958. All of these are expected to be added in round 2 is what we have been mentioning. Definitely they will add in round 2 all of these. The seat increase has not been accommodated. So BJ Medical College Ahmedabad, biochemistry, from 3 to 7, 4 seats have been added, but you will see only 1 or 2 seats. Basically 50% of this only you will see. You will not see the additional seats in the seat matrix. Let us say here, you're saying SN Medical College MD General Medicine, 20 to 24 seats, the increase might not have been accommodated. 10 seats only might be available here in All India quota, 50%. The additional 2 seats out of the 12 to be surrendered might be appearing in round 2 is what we have been saying. Similarly, these are already existing seats, existing courses where there is an increase. There were similarly, you see, let us say in SN Medical College, MD General Medicine, newly 2 seats have been added. One should have been in All India counselling in round 1, but it was not there. We expect that it will be in round 2, but now we have slight hope that given that many changes are happening, if they were able to include this within 1-2 days, it might possibly, they would have already, if they had communicated and asked institutes to include it, then that would be good. So all these are expected. If they come in round 1, good. Otherwise, they will definitely come in round 2 is what we expect. There are also some institutes which this you can also see in ZyNerd. Go to the seat increase. We have already accommodated the 958 deemed to. If you go to the seat increase, you will see all the seat increase details exactly. All the 2330 and the 958 in deemed. You will be able to see. Don't worry if they are not there in the seat matrix now. You will be able to get them later. 50% of government and all the deemed will be in All India counselling. ZyNerd seat increase tab might not have something like this. Kurnool Medical College, MD General Medicine. 20 seats last year have increased to 29 seats this year. Why? Because NMC's notification, which says the new seat increase, does not contain this. Why? Because this 29 seat increase was approved for 2024-25 itself for Kurnool. And last year, instead of 29, they still assumed 20 and gave 10 to All India counselling and 10 to state counselling. Will in effect seats increase this year? Yes. Now they have surrendered 14 seats to All India counselling. So last year comparison, yes, it is an increase, but actually in the NMC 2025 increase, it is not there. So such minor things might be there. Please accept our apologies on not being able to capture so many things. We have been able to capture the rest, but some of these will be missed out. To those extent, it might not be required to do something, so we haven't done that. Spending another 2 weeks, a team spending 2 weeks on such minor things, because anyways you're going to have it in the seat matrix, might not be required. That is why we haven't done that. Next, new seats yet to be added or approved. Basically, all these are numbers we have now. Whether there are going to be seats yet to be added, deemed seats we are waiting, but deemed seats have already been approved, 958. Beyond that, private institute seats are going to be there. When will they be approved, or when will MNMC put up the notification saying they are permitted and the institute can go ahead? They have to notify. Deemed notification is done. All deemed institute seat increase will reflect from round 2. All India counselling 958 will reflect as what we think. Maybe in round 1, because they have done it in a hurry now, and they might ask deemed institutes to add those seats. It should not result in another confusion, but maybe with a 1-2 day delay, they might be able to do that in round 1. We are waiting for confirmation on that. Even if not, definitely in round 2. Private seat increase, they have not put it up yet, but this impacts only the state counselling. Whenever they do it, the state quota, it will be added. They have not done it yet. Beyond this, maybe in government, minimal 15-20 seats or 30 seats might increase across. They've already done the government approval, but if there is something that has been missed out, or basis representations, if they are doing it, then that might happen later. Now we move on to the MCC DNB seat matrix confusion. That will be part of the next session, where we will cover a lot of things on DNB NB diploma seat matrix confusion. Thanks a lot for watching.